Hi everyone, thanks for joining us, and we apologize for the late start. I'm Nick Pappas from the Department of Health and Human Services, and we're here live at the White House today with the Secretary of Health and Human Services, Kathleen Sebelius, and Senator Murray from the state of Washington. And we wanted to thank everyone for joining us, and I'm going to turn it over without further ado to Secretary Sebelius for some comments on health reform. And we also want to make sure that you know that on the chat stream you can send in your questions, and we'll try and get to as many questions as we possibly can. But first, let me turn it over to Secretary Sebelius.
Well, thank you, Nick, and hello, Senator Murray. I'm just delighted to have a chance to be involved in this conversation this afternoon. It's an exciting time in Washington. Yesterday, the Finance Committee, the fifth and final committee, voted to send a bill to the floor of the Senate, and that's a step that's never happened before. So now we have bills in both the House and the Senate that need to be merged and ready to go to the membership for another discussion and vote. I'm here with Senator Murray, who's been a real leader, part of the HELP committee, not only in this process of health reform, but during her term in office, really focusing on workforce issues and a variety of health issues. So I hear from everybody across the country, I assume Patty does too, that the status quo just is unacceptable at this point, that we need action. We need action this year. Too many families, too many states, too many businesses are really struggling with high costs, low quality, and we have an opportunity to make an historic step in this country. So I'm pleased to be with you. And Senator Murray, I don't know what you're hearing from your constituents, but maybe you're hearing the same thing I am.
Well, thank you, Secretary Sebelius. I'm delighted to be a part of this live chat conversation and answer questions from people. I go home to my home state of Washington almost every weekend, and I hear from so many people who have huge concerns about the healthcare system as it is today. They have a lot of questions about what we're doing, and they want answers and want to understand it. But I think most people know that what we have going today isn't working for people. I remember talking to this young little boy a few months ago whose mother worked at a fast food restaurant. She had a job, but she got sick. She lost her job because she lost too many days at work, ended up losing her job and her health care. And because she didn't have health care, didn't go to the doctor and ended up dying. So this young little boy all of a sudden was without a mom, and he said to me, "Don't forget me." And I think about him every day as we now work through this process. And I talk to business owners who tell me that they've been buying health insurance for their employees forever, all of a sudden got a bill that was twice as much as last year and are now not covering their employees and asking me what they're supposed to do. And I talk to senior citizens who rely on Medicare today, and they're concerned about what they're hearing because there's so much misinformation out there. But they know too that what's happening for their grandkids and their families isn't sustainable, and we have to do something. But they do have questions about it, so I think this is a great opportunity to answer some of those questions so that people can feel confident, ask those of us who've been working on it, that this is the right thing to do and it's going to make a tremendous difference for people in the country.
Well, Senator, I know you've been hearing from a number of your constituents and questions. I don't know if you have any questions that you brought with you that you'd like to start us off with.
Well, I do, and I got some online that I wanted to share with you, and we'll start out with one of them that is really typical, I think, of what a lot of seniors are saying today, because they're hearing, cutting Medicare, and they think, oh my gosh, this is something I rely on, don't want that to happen. Right. And I got a question from William from Deming, Washington, who sent a question through my website, and he said, "I'm afraid that Medicare is going to run out of money. How is health reform going to make sure that I continue to get my benefits?" So why don't you jump in and...
Well, I think that's a great question, first of all, and I think you're absolutely right. People are concerned. I have an 88-year-old dad who thinks Medicare is pretty great, and so personally I'm watching very carefully. But Medicare is scheduled to be out of money in about 7 years, and part of health reform is really making sure that it continues on to not only the next 10 years, but the 10 years beyond that, the next generation. Keep our promises that seniors will be able to rely on health care. So when people hear about Medicare savings, we're doing a couple of things. We definitely will stop overpaying for equipment and materials and plans that have been demonstrated that we're just paying too much as a government. We're not going to do away with the benefits, but we're going to stop overpaying. We're going to have some competitive market bids. continue on down the way. The president has asked me and the Attorney General to really ramp up our efforts to go after fraud in the Medicare system. We know that far too many folks are really stealing money from the system, stealing taxpayer dollars. And so just in this administration, just since President Obama has been elected, we have actually stamped down and found almost $3 billion. A big settlement with a drug company who was charging for medicines they should have never been charging for, some sting operations in Houston and in New York, but almost $3 billion has been returned in the last 8 months, and that effort will just ramp up. Not a dime of Medicare money will be used for anything other than paying for Medicare benefits, so closing the donut hole. 4 million people every year hit a wall with their drug benefits, and part of your efforts, Senator, are to make sure that we actually don't have that system in place anymore. So seniors who need medications will continue to be able to pay for them. So the kinds of overpayments for equipment, fraud money will go back and close the gaps. More primary care that won't have out-of-pocket copays for seniors. So Medicare will actually be stronger with health reform.
And I think that's one of the misinformation or concerns that we hear, because when seniors hear us talking about cutting Medicare by hundreds of billions of dollars, they think, oh gosh, that means my benefits are going to get cut. To the contrary, not one of the 5 proposals that has now gone through a committee cuts anybody's benefits or makes them pay more out of pocket. What we try to do is look at the system and say there are a lot of overpayments in this system, billings that go out twice, and all of us are paying for that. We can reduce that and save a tremendous amount of money within the Medicare system, and it helps seniors today, and it will make sure that those people who are in their 40s and 50s and saying, what's going to happen to me when I retire, this system's still there for them. So these steps are really important.
Absolutely. We're getting a number of questions from folks who are watching online, and we want to encourage you to continue to keep sending your questions in. One question that we received from John Hayes is, if insurance companies will be required to insure all applicants, what's to prevent people from opting out of their current coverage and simply buying insurance only when they are sick?
Well, this is a question that we struggled with a lot on the Health Committee, where we passed a bill out several months ago, because we want to make sure that that the system works for everybody and that everyone has the opportunity to have choices, but that we don't have wholesale businesses saying, well, if the government is going to provide other options for us, we're going to drop coverage ourselves. We actually did a number of really hard looks at this, and the economic advisors and CBO say that the way that the bills have been set up, businesses won't do that. And that rhetorically, I know that as well. I've talked to so many business owners who say, look, my costs are going up for my employees. I provide good insurance. I want to keep it. But I can't continue to pay those high costs for people who don't have insurance. So when we bring in millions of people into the system and have them pay insurance, it will actually lower the costs for most of our businesses, and they can keep what they have. And we are finding that that is what they'll do.
That's great. I don't know if we have other questions that you brought from your constituents in Washington?
Well, I did. I had one from Thomas from Edmonds, Washington. He sent me a number of questions actually about health insurance reform, and he said he was very concerned about the fact that as we insure more people, there will be fewer doctors to go around, and wanted to know how we ensure that there's an adequate healthcare workforce to cover all people. This is a real concern that we are addressing, because it is true. A lot of people don't go get their primary care today, don't get preventive care. They end up getting sicker later and costing us more. But if we now have a better system that everybody gets that preventive care, how are we going to have enough workforce? Something we worked very hard on in the Health Committee. I actually wrote a section to help make sure that we bring more doctors into the system by providing them better help to go to college and go through. It's very costly to become a primary care physician, but a lot of workforce development to make sure we've got the capacity for that. And I know in your department you're working on that as well.
We are, Senator, and one of the things that you and your colleagues also did before health reform was even discussed is as part of the Stimulus Act that was passed and the president signed into law early in January was some additional money for the workforce, for the medical workforce, more scholarships to be paid off for docs to come into the system. And not only doctors, but nurse practitioners and mental health professionals, recognizing that we need additional medical personnel, more money to actually reward doctors to be in underserved areas, so dense urban areas, and sometimes in rural communities it's hard to find a doctor, so there are some incentives to do that. And one of the other big steps in the stimulus package is health information technology, going to a sort of paperless system with electronic medical records. What I hear from doctors all over the country is it lets them have a lot more time to be medical providers and not just fill out forms. So you could take the same number of people, and with a system where a lot of the information is automated, where they don't have to continue to handwrite charts, where they don't have to fill out billing forms, they actually can have more time with patients and see more patients. And finally, we'll get to the point where if more people have preventive care, more people have checkups, more people get in the system at an earlier point, they actually need less timely follow-up care. Fewer will come through the emergency room doors, and will free up emergency rooms for truly sick patients, but also get to people at a much earlier spot and keep them healthier, so they won't be seeing the doctor when they need 4 or 5 follow-up cares to be hospitalized, but hopefully be well in the community.
Well, and one of the reasons we know that healthcare costs are growing so exponentially large and costing us more and more is because of people re-entering the hospital after they've been released and going back because they didn't get the kind of care they need. That means we need physical therapists and kinds of primary care physicians for people to see, so they don't end up going back to the hospital time and time again because they didn't get taken care of right. That's a workforce issue. We need to start early. We're really focusing in this bill on developing that.
We've got a number of questions that have come in online. We encourage you to keep sending in your questions. And we've got a number of questions from Washington, so I thought we'll go with one from Kansas. And Kathy in Wichita asks, does the public option mean a one-size-fits-all policy, or will it provide a variety of plans for people to choose from?
Well, actually, Kathy, that's a great question, and a shout out to my sunflower state. You know, what the bills anticipate is a new marketplace that would have private plans and a competitive public plan. So one of the choices that consumers would have, along with a number of private plans, would be the so-called public option, or a co-op, or a not-for-profit. There are a couple different variations for it, but it would be a consumer choice. Play by the same level playing field. So if a worker were to be subsidized in a private plan, they'd also receive a subsidy for the public plan if that's what they chose. And the goal is to have consumer choice and to hold down costs by having some competitive options. So a new marketplace for folks who don't have insurance at all now, or for folks who have some limited coverage, but it really doesn't cover what they need, and that's what the new marketplace is about. But the public option is one of the consumer choices in the new marketplace.
Great. Senator, I don't know if you have additional questions from
Well, I do. I got a question from Gregory from Seattle, and he told me about his sister who had insurance, but she was forced to declare bankruptcy due to a medical emergency, and he wants to know what we can do to prevent insurance company from doing things like that. And I thought it was an excellent question. You want to jump in?
Well, I'll start, but I know you've worked on this a lot. You know, the number one cause of bankruptcy right now is a medical situation. And so one of the things that I think the members of the House and Senate, and I know the President cares a lot about, is that people shouldn't be driven into bankruptcy because they get sick or a family member gets sick. A lot of the people who end up declaring bankruptcy had insurance, but they find that their out-of-pocket costs were so high, the unpaid bills, or they read the fine print and realize what the policy doesn't cover. Right. So, you know, it didn't cover this kind of cancer treatment or that kind of heart treatment, and they end up with thousands and thousands and thousands of dollars worth of unpaid bills. What the bills say is insurance rules change in this new system once and for all. A limit on out-of-pocket costs, a limit on the kind of pre-existing condition, insurance companies wouldn't be able to pick and choose who comes in and who comes out of the system. They couldn't say, after we pay so many dollars for your cancer treatment, we're going to cut you off, knowing full well that your choice is to die or to pay out of pocket. That those rules would have to change in a new system. And the trade-off for that is that we would say to folks, you've got to have insurance, whether you're sick or well. You can't just opt in and out, but everybody gets covered and the rules change. So the situation with the family bankruptcy hopefully would never happen again in America.
Exactly, and I think that's one of the things I'm really excited about with all the bills that have come out and are moving forward now, is we're saying, people buy insurance because they think, I'll have this policy and I'll be okay.
Right.
And too many times they've paid for that policy forever, and then when something bad happens, it doesn't cover it, there's a pre-existing condition, they've reached their cap, their insurance doesn't cover whatever it was that they thought they had, and they find themselves all of a sudden paying thousands of dollars for something they never thought they'd have to plan for, and they'd have to end up declaring bankruptcy like he was talking to me about. That's what this insurance reform and healthcare reform is going to do, is make sure that health insurance companies that offer coverage in this country have to live by rules and play by rules that are fair to the people who are purchasing their policies. Can't discriminate against people because of pre-existing conditions. You cannot put a cap on policies and a number of other things that will assure people that when you're paying your insurance, it will take care of you if you become extremely sick.
I used to say health insurance was one of the only products sold that if you used it, you were considered a bad customer. So, people buy it to protect themselves and their families, and too often run into these barriers. A lot of folks say, we don't want anybody standing between my family and the doctor, but too often it's an insurance company who says you can have this treatment, you can't go to the hospital, you can't buy this medication, and they're making those decisions day in and day out.
I met with a group of people to talk about healthcare reform in Spokane, Washington, and this woman brought in a stack of paper this high, plopped it down in front of me and said, this is what I've been doing for the last year as my husband has been terminally ill, fighting with my insurance company while I fight to keep him alive, to cover what I've been paying for the past 35 years. Now that just shouldn't happen, and that's what we want to do with this bill.
One question that we've received online comes from Laura Ben in Spokane, who asked, why is tort reform not looked at and letting people buy across state lines?
Well, we hear a lot about this buy across state lines that I hear some Republicans throwing out. Sounds really good when you say it, but the fact is that if you allow insurance to be just purchased randomly without any kind of care for it, people will go to the bottom very quickly. There are good insurance policies and there are not good insurance policies. And if someone from my state is sold a policy that perhaps is sold in Mississippi or another state, and they don't have the ability to fight to get their coverage taken care of if something goes wrong because it's another state, they end up losing out. So we have to be very careful, although that sounds good, and if we're going to go in that direction, we're going to have a lot of regulation across 50 states to make sure that people have a way to make sure that they are taken care of.
Well, and Senator, there's, in one of my former lives, I was an insurance commissioner, and nothing at all prevents a company from filing rates in all 50 states. State companies right now, and lots of them do it, sell in Washington State and in Kansas and in Connecticut, so that goes on. What, though, comes with filing a rate in 50 states is consumer protection. So somebody's making sure the company has enough money to pay the claims, and somebody's making sure that if the company denies benefits, there's a place to go and complain. So sometimes when companies say we want to sell across state lines, they also don't want anybody on the ground who can deal with consumer complaints.
And tort reform was the other part of that. Certainly hear a lot of people throwing that at me. Our state has really grappled with that as well, because certainly we don't want doctors requiring a number of tests, for example, just to make sure that they don't get sued. But you also have to make sure that if somebody does do something terribly wrong, that the person that pays for it isn't the victim of that. And And it's a real fine balance that a lot of our states have dealt with in a very positive way. But the interesting thing is, despite we hear this all the time, it is a very small amount of money within the whole healthcare system that we're talking about when it comes to tort reform. The president, in the address that he brought to us, talked in fact about your agency doing some pilot projects to find that balance, and we're all looking forward to hearing from the results of that.
We're underway right now. We have identified about $25 million to make available to either states or healthcare systems, because there are some interesting models in place that look at how to increase patient safety, how to get injured patients paid in a more timely fashion, how to increase communications between doctors and patients, and how at the end of the day to lower malpractice rates. So we want to look and see what works across the country, give states some opportunity to put projects into place and really bring those back to you. But that's underway right now. The grant applications are available, and we hope to award them at the beginning of the year.
I think we have time for one more, and I think we can take one of the questions that you brought from your constituents.
Great. I have a question from a doctor in Mount Vernon, Washington. I think it's Winkies or Winkies. He is a family physician, and he told me about one of his patients, and he asked a question. He told me that he has a 63-year-old patient who desperately needs preventive heart care but is uninsured and can't afford it. And he wants to know what we're going to do to make sure that he's able to give his patients the treatment they deserve at a cost they can afford. I mean, my instant answer to that is who we're talking about. Is somebody who doesn't have insurance and finds themselves extremely sick. And we want to set up a system where no one finds themselves in that position. That's what all of our healthcare bills do, is set up choices and options for someone like this to have being able to pay for insurance, so when something like that happens, they don't find themselves at the short end of the stick.
And your doctor has identified somebody in the age group who often is in this really difficult time. They'll be eligible for Medicare when they get to be 65, but I talk every day to folks who took early retirement. Didn't really think about the fact that health insurance came with their job, and their spouse's health insurance came with their job, and they are now in a market where they can be charged, $20,000 a year, $15,000 a year, because you don't get to be 63 or 64 often without something having gone wrong at some point along the way. So they're either blacked out because of a pre-existing condition or locked out because the price is just astronomical. And you're absolutely right. That's who we're looking at to try and make sure they have affordable choices.
He's on his own today. Good luck going to buy an insurance policy. But if we make sure that everybody can go into the same pool and he's with everybody else, and the insurance companies have to provide him with care, he will get a plan at a cost that he can afford.
Well, I want to thank everyone for joining us online who took the time to watch the chat, and I want to encourage everyone to go to www.healthreform.gov, where you can learn more information about health reform and learn more about the President's plan. Thanks again for joining us, and we appreciate your time.